regarding treatment, and local treatment and general complex treatment. In local treatment, both ointments and gels are used. Ointments, as a rule, are acyclovir ointment, Zovirax ointment, Panavir gel, and gel Viramerts. Here, in folk medicine, there are also some interesting recommendations. For oil, then propolis is used, calendula ointment, aloe juice. They recommend drinking a juniper decoction to boost immunity. That's what folk medicine suggests to us. As for general treatment, it's mainly antiviral and immunomodulatory. There are a whole range of antiherpetic drugs. Yes, there's an entire list, but it's all individual. All of this is selected individually for each patient, just so that's clear from the start. In other words, there isn't a specific protocol. And so, if you hear me listing medications, you still shouldn't rush out and buy them right away. You need to see a doctor for a consultation, and then the doctor will decide what exactly is suitable for your body. There are tablets, antiherpetic medications. These include agoprinacin, isoprinazine, Valtrex, Zovirax, and famciclovir. Famciclovir, well, in general, actually provides a very quick recovery. It's a fast treatment. This is an express remedy for herpes, basically on the face, wherever it is, on the nose, inside the nose, or on the lip. In other words, anywhere on the face. And it's usually enough to take 3 tablets a day for just 2 days. And literally in those 3 days, everything goes away. So it's quite a potent medication, leaving no trace. As for immunomodulators, cyclosporin is recommended, as well as Immunofan, Amixin, Love Max, and similar drugs, Nivert. You can also use Viferin. Viferin suppositories work very well, and they're suitable for children, since kids don't really like injections. As for topical therapy, there are ointments like acyclovir and Zovirax. These ointments are used quite often during the first few days, mainly to suppress the replication of the virus and help it calm down as quickly as possible. So we use the ointment and apply it up to 5 times a day. Doing this for about 5 days is usually enough. And we can see how everything subsides and even the process of epithelialization starts to develop. So these blisters get suppressed, they fade away, and healing begins. The same goes for using Panavir gel. The gel also works very well. It contains double interferon, and it also includes a natural ingredient. So it basically has a dual effect. It blocks the virus and at the same time promotes healing and epithelialization. They also use Fenistil cream. But it's mostly used for itching, especially in the first couple of days when there's intense itching and burning, that kind of allergic reaction with swelling, then Fenistil works really well. That's it. As for the transitional stage, when the sore doesn't heal for a long time, that's when we start using other medications, more for healing. So you can safely use Salcacerol, although it's not an antiviral, it's more for wound healing. But it helps close up the wound and promotes epithelialization without any scarring, so it works really well. Oxalinic ointment is also a good option. It's old, ancient even, but it works. It really works great, especially for the nose area. Viferin is also an excellent ointment. It literally blocks the virus within the first 2 days. You should apply it as often as possible. You can use it up to 8 times a day. It's harmless. You can even prescribe it to pregnant women, so it's totally safe. And within 5 days, everything heals over and the acute phase passes. 5 days is enough. Now, as for folk remedies, right? Freshly squeezed kalanchoe juice or aloe juice also works. They both sting a little, kind of cauterize, but at the same time they help with healing too. But here, it's more about the healing effect as a healing agent. That's it. As for medications like protoflazid, that's also a good one. It's natural and harmless as well. It comes in drops, and the treatment follows a specific regimen. You can use it for about a month. But if relapses happen quite often, then protefazone is prescribed for 1 to 3 months. So this medication can be safely taken by both children and adults. But for children specifically, there's actually a separate medication called fluvaxid. It's basically a generic version of protoflazid. The treatment regimens are similar. Everything is outlined in the protocols according to age and, accordingly, weight. That's why you should see a doctor and get a consultation, because treatment is individual for each patient.